So I'm a little bit of a storyteller, so I'm going to tell a story. So in 2010, I was at the height of my fitness journey. I was like boot camp crazy out, went to boot camp all the time. So in boot camp, what had happened was that we were doing medicine ball slams. And I don't know if you know what a medicine ball is, but it's a big round ball, and so they're about 25 pounds, and we'd lift them over our head and slam them down to the ground as hard as we can. And for some reason, we had to pick it up, lift it up again, and slam it down to the ground again. And so as we were doing that, after several repetitions, I felt a pop in my back. And I dismissed it. It's me. I was like, it's a little painful, but I dismissed it, right? And so I continued to do the workout. And as I got to the end of the session, I realized I didn't have spinal stability. I could not hold myself up. I was kind of like that childhood toy, like a weeble wobble that you hit and then it bounces back up. That was kind of me and my spine. And so with that being said, I was able to make it home. And when I made it home, that was the first slide, sorry. So when I made it home, I attempted to get in the shower. And when I got in the shower, I thought it would alleviate the pain that I was having, some of the discomfort I was having, but I was in excruciating pain. So it didn't alleviate any of the pain. In fact, it made it worse because I slipped and I fell. So it made it very difficult for me to get out of the shower. So I flopped out of the shower, was able to grab a robe, and then I crawled down my stairs to get to my landline to call 911. So I called 911, they came, and they gave me a little bit of pain medicine, and they took me to the hospital. It just so happened to be the hospital where I was a nurse manager. And so upon my arrival, I was in disarray. I mean, I looked a hot mess, right? I was, half of me was still sweaty and stinky. The other half was showered. My hair was wet. I only had on a robe and nothing underneath it. Even my husband, when he showed up moments later, reminded me that I didn't shave my armpits. And so it was just a bad situation. So I go into the emergency room, and I was met with skepticism, indifference, and apparent bias. I don't know if it was because I was black or because I was female or because I'm deaf and hearing impaired, but I knew that I was not being treated correctly. And so I even mentioned that I was a nurse, but that kind of went over their head. I didn't quite look the part, right? And so the doctor ordered an ultrasound, and I begged and pleaded for him to do an MRI, because the MRI shows more. He went through the motions, he kind of dismissed me, and he gave me the ultrasound. Well, the ultrasound didn't show anything. And then he sent me out the door. You can go home with a low dose pain medicine and see primary care in about 2 days. I still did not have control over my upper body at all, whatsoever. And so days later, I went to my primary care physician who knows me very well. And he looked at me and he said, "Jitana?" He said, "Something's wrong." I said, "Yeah, something's wrong." So he reviewed the labs from the hospital and he looked at the ultrasound. He said, "You need an MRI." And I said, "I know." I had substantial swelling in my back. The MRI showed that I had 2 torn metatarsus muscles. So when you think about your spinal column, you have 2 metatarsus muscles that go up the spinal column. They keep your joints in place. They make sure that you're stable, make sure you can turn from side to side, right? And so I had tore those. But it also showed compartment syndrome. And I don't know if you know what compartment syndrome is, but basically in our muscles and sacs, we only have space for just a little bit. So a little bit of swelling is okay. But when you have substantial swelling and blood, right, it causes pressure, and that pressure builds up and it damages the tissue and the nerves. So I had irreversible nerve damage because of this. All of this could have been mitigated by having a physician that listened to me at the point of care. And so now I'm left with these physical and emotional scars. What we do know is that in 2017, there was a report that looked at, and this was from the Academic Emergency Medicine Education and Training Journal. They looked at physicians, and what the physicians told them specifically, that if people came from certain socioeconomic backgrounds or racial backgrounds, they considered them less educated and less likely to comply with medical treatment. So as a result, sometimes they undertreat, undermedicate, maybe delay referrals to other doctors, and sometimes they just flat out refuse care. So this isn't just my story. It's a narrative that resonates with countless of individuals who have faced some sort of bias in healthcare settings, whether that's sexual orientation, whether it's ageism, whether it's ability. It is happening. And what we know is that when it intersects, when you have multiple ones, like I said, being black, being deaf, being what he perceived to be lower socioeconomic level, then you're going to get less health care. And so it's a testament to the silent crisis that jeopardizes patient safety and dignity. If it can happen to me, someone who's educated in the field. By the way, I didn't mention that I was a trauma surgical nurse manager, so I knew a lot about trauma at the time, so I knew what I was talking about. So if it can happen to me, someone who's knowledgeable about the bodies and the process, it can happen to anyone if you go into a space where you're culturally different from the person that's taking care of you. And so with that being said, silence in healthcare is not the absence of noise. Basically, it's the absence of safety, okay? When we keep our mouth closed, when something doesn't happen well in healthcare or we don't get the care we need, we put ourselves or our loved ones at risk. So when patients' voices are dismissed or ignored, it leads to misdiagnosis, inadequate treatment, and in some cases, irreversible harm such as death. And so why do we operate that way? Why do we keep quiet? Even as a nurse, there have been times at the bedside where I thought something wasn't right. So why do we keep quiet? How come we don't challenge the system? How can we just allow it to continue? Well, I believe it's because we operate in a culture in the hospital setting where psychological safety, which is the ability to report and to have a conversation and to show up authentically as yourselves without penalty or retaliation, is a buzzword, not a baseline. It's where speaking up feels dangerous, like for trespassing, right? And then it makes silence feel like it's survival or safety. So we perpetuate this crisis in healthcare in such an environment where our voice isn't a privilege that we all should have. It becomes a protocol where only some people receive it. And so this culture teaches us, and this is patients, nurses like myself, other healthcare providers, and even families, because sometimes families come and they don't feel comfortable advocating for us, that staying quiet is safer, but it really isn't. Make the noise. Make a little hell. Sometimes you have to advocate for the ones that you love. You are their voice. And so when nobody speaks up, we think that the problem gets smaller. It doesn't. It can be fatal, right? So we do know that for Black women specifically, they're 2.6 times likely to die having a baby than the white counterparts. So we know that certain populations of people have worse health outcomes than others. So it makes it very important that we use our voices to communicate. If you don't feel right, you may not be the expert, right? But if you don't feel right, make a little noise. Tell them something is not right. You're not listening to me. Because we have to have what's called moral courage. That is the courage to have a conversation, even when you're uncomfortable, but you know that it's right. So we need to have moral courage. So in healthcare, this issue of us not listening to patients' voices is not a moral courage issue. It is an act against humanity issue, meaning we're not seeing other people as humans, and we need to, whether it's the color of their skin, because it's their age, because they're on welfare or Medicaid. Any of those things can keep us from getting the care that we deserve. And so knowledge, I say this, knowledge without psychological safety, you have to have both, right? It's like a fire without oxygen. It kind of flickers without and then fades, right? So we have to have an environment where people are psychologically safe to come forward and have discussions, because then that gives them the moral courage to have difficult conversations. And so implicit biases or explicit biases against certain populations influence clinical decisions, but it also influences health outcomes. And I don't know if you've ever went into a waiting room or to a doctor's office and felt like you wasn't listened to. I hear that from a lot of women. I did a documentary a few years ago with women where they said that if this was my husband, it would have been treated. However, it was me and no one listened to me. It's also said that a lot of women sometimes are sent to psychologists and psychiatrists first because they think that it's in our head when it's really in our bodies and we're not listened to. So these studies have shown that, we've got to do something different. In the black population specifically, there was a study that came out a few years ago that black people don't feel pain. If you come up here and you punch me in my gut, I'm going to feel the pain. I'm just going to tell you, I'm a little weakling. But the issue is they think because the skin may be a little thicker and that we have a higher pain tolerance, we don't feel pain, and we do. So that has caused physicians to undertreat our pain. A survey by the Kaiser Family Foundation and the Undefeated noted that 48% of black adults in the U.S. have faced some sort of discrimination when seeking health care. And so what happens in those situations? Either they don't go, which makes their conditions worse. So then when they do present up to the ER, sometimes we can't treat them fast enough, or maybe their conditions are far worse because they didn't get the primary intervention that they needed. Or they just avoid what we call healthcare avoidance. And you may have family members, regardless of your race or ethnicity or background, you may have family members that absolutely refuse to go to the doctor because they say they don't listen. They don't help us. They just take our money. And so now we've got to use our voices to say, hey, I'm here. I'm seen. I need to be seen. And my needs matter. So having bias in healthcare, it exists. We know that it exists. We have plenty of studies out there that say bias against different populations, even children, the disabled. There is bias out there that they get less care, and that's what we call health disparities, and we want to avoid that. But these biases erode trust, and they compromise care quality. And so imagine if we flip the script, right? Imagine a workplace where it's culturally responsive to all cultures. We all have a culture, right? I'm a very rural girl. I'm from Kentucky. And so what if they recognize my culture and they recognize me and they see me when I show up and they understand how to take care of me? That's patient-centered care, which is what we want, right? And so with that being said, how do we do healthcare very, very differently? And so where do we show up in an environment where our voice isn't just a privilege and it's a protocol? Where psychological safety isn't something that we have to earn in our roles, it's what's expected, and where moral courage is not just an exceptional thing. That nurse did a bang up good job today because she reported an injury. But it becomes a norm where we're all reporting things that's happening in the environment. Maybe mom's bedside remote is too far away from her, and you're worried that she may slip and fall. Those are the things that we need to talk about in healthcare. So silencing black voices specifically, because that's a population that I work with, isn't just a historical injustice, it's a present day crisis for everybody. It's not just affecting black people, it's affecting white people, and it's affecting Asian people, and it's affecting everybody, because our voices are being silenced when we go to get healthcare services. So how do we get our power back? We shouldn't have to feel like people are a skeptic of us, or they downplay what we say, or they dismiss what we say as being normal, because it may not be normal to you when you experience something. So we need to have those difficult conversations with our providers. So this isn't merely about that individual interaction that you have with your provider. It's about a system that normalized devaluing people and dehumanizing people. And so we need to find ways that we put love, respect, and honor back into our healthcare system, and where we honor each other as individuals. And so as healthcare providers, especially nurses, because we are the largest workforce, right? And so we are about 4.3 million in the healthcare workforce. We have a responsibility to listen actively. And that means sometimes we have to shut up. And I love to talk, but sometimes I have to listen to my patients to understand where they're coming from and not make assumptions because I've seen this before. It also means we have to advocate fiercely, meaning that if there's a policy in the hospital that doesn't allow a patient to get a certain procedure, that we're advocating, whether in the hospital walls or at the Capitol. We've got to do things differently. So our silence, whether it's in the face of a colleague making a biased remark or a policy that perpetuates inequities, if we say nothing, it makes us complacent. It really does. And so we must recognize that by speaking up, It's just not about voicing concern. Sometimes you feel like the nag in the room. You feel like, the wife that's nagging the husband. So it's not about just voicing the concerns. It's about disrupting the status quo that endangers lives and shows our lack of humanity towards people. And so moral courage in healthcare means confronting uncomfortable truths and challenging entrenched systems, because the systems are thick. It means acknowledging that our training, even our providers, and even our institutions at times have failed to protect the most marginalized amongst us. So we have to commit to cultural responsiveness, getting to know the people that we're taking care of, in their environment, who they are. I'm from Kentucky, so we have the Appalachian area. I consider myself Appalachian. That's a population of people that you have to get to know and interact and know that they're very family-centered. They're very quiet. They have to build a relationship with you first before they may tell you their healthcare systems. So we need to know the people that we're serving. And also, we must understand that it's not a checkbox. It's something that we have to learn and unlearn over time. I always say that we're constantly learning. There's no thing as cultural competence, but there is intercultural development, meaning I can learn about your culture. I may not know your culture, but I can ask you about it, and we can share and we can learn. So this is about empowering people to speak forward about discriminatory healthcare practices if you have it. Don't sit in silence. Don't fear retribution. Speak up and use your voice. And finally, let's reflect a little bit. Where in our silence do we prevail? Do we get ahead by being quiet? No. Where do we have bias? Where we have bias is where we have reduced health outcomes, and we know that, right? And then how can we transform our systems to uplift every voice? And I do mean every voice, especially those that are historically marginalized. What we need now is boldness. We do. Not just from nurses, not just from physicians, not from administrators, from patients and families too. We need boldness. We need for you not to ask permission. You don't have to ask permission. We want you to take action. So if you see something in your environment that's not working, take action. Speak to someone. Ask to speak to someone in charge so that you can get the care you need. Because a system shouldn't punish the brave. It should celebrate them. Thank you.